organization, we are spending much of our resources to make sure that the young people are the center of programming. It includes in all levels. So we are using youth-centered approach where young people are the ones who are leading all the processes in all levels of the organization. This is through meaningful youth participation. We provide the enabling environment where we give them the capacity, financial means, we allow them to make decisions, we give them responsibilities, and we also conduct evaluations to make sure that we are always moving with time.
The woman is supposed to cook for the husband and the children.
As an advocate, I champion for implementations of new or existing policies that promote SRHR, including ICPDO and Sustainable Development Goals.
So, the youth program has helped me develop my personal skills, confidence. Before I came at the center, I didn't have the courage to speak in front of people. I've also been able to develop leadership skills, also facilitation skills. I can now be able to stand in front of my peers.
Young people are being trained so that they can enhance youth-adult partnership, and even we promote youth-led activities. These include youth-led outreaches, youth-led advocacy activities at the county or the grassroots level, and even youth-led planning, so that in our youth centers, young people are involved in planning, in delivery of activities, and even assessment, so that we can be able to learn lessons at every level of the activities and the projects that we are implementing. So meaningful youth participation is very important because it even gives the young people that enabling environment to mobilize their peers and work in partnership with adults.
The youth program has really assisted me as an individual in terms of my goals and objectives in relation to the young people in Kenya and the society at large. We have been able to do outreaches and enrich activities that have been able to guide the young people, especially when they want to achieve their objectives through the various platforms.
We have been able to do vetting for the young people to identify the different skills we need to address, and this is done through youth-led skills mapping and needs assessment, where we identify where they need skills and the ones we can be able to support them. So we have conducted a number of trainings to empower young people so that they can be able to lead these activities. You know, leadership is one of the aspects we are really focusing on.
Meaningful youth participation, which we mostly regard to as MYP, this is simply the involvement of young people in the implementation and design of programs.
I have worked with several people towards gaining facilitation skills and programs on training that have actually enabled me and empowered me to actually focus on mental health issues that are affecting the youth right now.
When I found out I was pregnant, I told one of my friends. She advised me to go to a bush doctor, but through FHOK, I've been empowered with the information to know there are unsafe abortions, there are post-abortion cares and pre-abortion cares, and I can empower young mothers that being a teenage mother is not a disease.
Family Health Options Kenya Egerton chapter will serve as a platform where the Family Health Option Kenya as an organization will implement most of their project based on the focus on the targeted group, because most of the students are teenagers. They are between age 15 to 19. So it will also serve as a good platform where they can do their projects.
My main purpose of joining it was building my skills and meeting these new people who would act as fans of my pieces, and they would contribute to me coming up with pieces that have content on gender, sexual, reproductive health, and other topics.
So at FHOK, I've learned so much. I've built up on so many skills, including communication skills and facilitation skills. When I first got to FHOK, it was hard to communicate with other people, especially new people, and it was hard to be able to lead a session because of the challenges when it comes to talking to many people.
About the program, it has really empowered me, in which case I've been involved in the review, development and the design of the curriculum, documents and manuals. I've also been really included. It has really given me a chance to meaningfully participate in the development of what entails the human sexuality education. So I really thank FHOK for giving us young people the chance to participate and air out our issues and also give solutions in the ways that we can address them as young people.
The youth program has assisted me in building my skills personally, like writing reports, being able to speak to others, my communication skills, my leadership skills, how to relate with other people, how to identify problems in our communities.
The youth program has enabled me to be able to actualize what I have learned. It gives you a platform to air the issues that you're passionate about and you didn't have anywhere to go to.
Relationship na masponsor, mimi siwezi.
Have sex na mode ndo nipate sexually transmitted degrees, mimi staki.
Mambo ya jobless corner, tupatane at center.
Ati condoms pekee ndo contraceptives. Sidanganya mse, fika center ujue mambo.
When nasema condom reduces pressure, but to me, na advise my youths mtumie condom.
Hii mambo ya kupiga dem ovyo ovyo, mimi sipendi kabisa.
I say yes to contraceptives.
Mimi kax na masturbation noma. Hiyo noma ngori kabisa, siwezi.
Abortion kwa bush doctor, mimi zi.
By the way, HIV ni real. Vijana, endeni mtestiwe saizi.
sex bila condoms. Mimi Z.
We're also doing mentorship for the young people, especially when it comes to employability skills. Because in our field and in Kenya, we realize that job opportunities are becoming very scarce. We are having so many graduates, but there are no jobs. And whenever they get an opportunity, they need skills. And some of these skills, they are not acquired in schools. So we have skills like mobilization skills, advocacy skills, writing reports based on project requirements. We have resource mobilization skills. So these are some of the skills that we impact these young people with so that they can be able to relate and they can be able to be of value in the job market.
Okay, the Youth Center has been a great platform to be in terms of my socialization with the others. Personally, I have a disability. I'm living with this disability on my left side. I mean, my left arm is paralyzed, same as my left leg, half paralyzed, but having a safe space has helped boost my self-esteem and realize my worth in life, as in when it comes to interacting with fellow youths. And at least through this platform, I'm able to put a smile on my face and live my life normal, not realizing that I'm disabled. So Family Health Options Kenya has been a great help in restoration of hope to me. Thank you.
I'm young, empowered, accountable and healthy. Yeah.
Young, empowered, accountable and healthy.
I am young, empowered, accountable, and healthy.
I am young, empowered, accountable, and healthy. Yeah.
I am young, empowered, accountable, and healthy. Yeah.
I am young, empowered, accountable, and healthy.
I am young, empowered, accountable, and healthy.
And so I'm young, empowered, accountable, and healthy. Yeah.
I am young, empowered, accountable, and healthy.
Yeah. I am young, empowered, accountable, and healthy. Yeah.
So I'm young, empowered, accountable and healthy.
Young, empowered, accountable, and healthy. Yeah.
Young, empowered, accountable, and healthy.
Young, empowered, accountable, and healthy. Yeah.
Young, empowered, accountable and healthy. Yeah.
I am young, empowered, accountable, and healthy. Yay!
You can interact with us through our social media handles.